want to get to the question about what can we learn about what is in the proposed state budget, because I think the facts by themselves are going to motivate us all to try and reverse the situation. So we call this the campaign for what purpose? Why? Because we wanted to say in this environment, when you know you have to make some cuts, don't cut the things that work. Don't cut the things that truly help individuals, where there are results, and also save the taxpayers' dollars. So we saw from the beginning, when we started this campaign, not yet a year ago, that this was about these two purposes that are in one. It's about truly helping people, but also considering what's good for the taxpayers. One of our main themes has been prevention. Grant talked about it a lot. How do you prevent both the terrible, rotten outcomes that can happen without really good services? And also, how do you prevent the extra unnecessary costs of some of our least efficient programs? And I think this is probably the most crucial part of my presentation. So when you cut the mental health services, now I have to tell you a little bit about these mental health services, and I was involved when I was at the county in helping to set some of them up, and Mark and his team have added to that. As the state decided to close its state institutions, they negotiated with Allegheny County and the other counties a program called CHIP, C-H-I-P-P, I believe. And there was an agreement, a signed agreement that said, Allegheny County, you'll take these people from the institution. We'll close the institution, and we'll give you some additional dollars to serve people who otherwise would go into the institution. So when we talk about mental health cuts, this is not somebody with a mild situation. These are individuals who are either long-term or serious patients within the state hospitalization. That system doesn't exist anymore. Those beds have been closed. Those hospitals have been closed. And now it looks like the state is going to renege on its agreement with the county. The people will still be there. It's not like the people disappear, but their services will. And what happens to a person with a serious or chronic mental health problem? And there's the same thing with the intellectual disabilities. You're going to be talking about individuals and their family members who are caring for them, maybe no longer able to care for them in the community. The respite services are gone. The day services are gone. Again, hospitalization, out-of-home placements, state institutionalization. Child welfare cuts. Child welfare, out-of-home placements, juvenile court placements. And remember, the courts decide these things. That they won't look, they won't take an argument from the county that says, we don't have the money. They will order those placements, and the county will have to come up with it. Homeless assistance cuts. Now, these are actually dollars that help homeless people not be on the street or help prevent homelessness. So you will now see more people on the streets of Pittsburgh. And then the cuts to the Human Services Development Fund. And they're used for a variety of purposes, but one section of them are used for people with physical disabilities who either need a homemaker or an attendant care person to help them live in the community where they want to live. Without those services, we're talking about personal care homes, assisted living, all kinds of additional services. Judy, am I stating that correctly? Judy Barisel says I'm stating that correctly. And then drug and alcohol cuts. So these are the services that help people who have addiction problems. And without these services, you can expect more criminal activity so that people can feed their addiction habit. You're going to see more hospitalization, needing the community hospital emergency room, and then intensive care after that. And you'll see more people in jail and the criminal justice costs that are associated with it. So we look at savings, right? This is supposed to be 20% savings. The truth is, we're shifting costs to other cost centers. These are individuals who need their services. If they don't get their services to help them live in the community, they will end up the doorstep of these other programs and institutions in our community. And they will cost at least as much, and I think as Grant said,